So we're going to be inserting an NG tube in this video. So I have seen an order from the provider for my patient for this NG tube insertion. I have gathered all of my supplies. I've made sure that I have the correct size tubing. So today we're using a 14 French. I've also confirmed in my patient's chart any allergies that she may have, and made sure that we weren't going to be using any of those materials. Also made sure that she doesn't have any history of any facial trauma or surgeries or anything like that. And I'll confirm that with the patient as I'm chatting with her. So we are going to open up. And hi, Arena, my name is Liz. I'm going to be your nurse today. Can you confirm your name and date of birth for me? We'll confirm we have the correct patient. Awesome. All right, Arena, I know the doctor has already come in and chatted with you about this procedure, but we're going to be putting an NG tube into your nose, and it's going to go into your stomach and kind of help relieve this like stomach distension and just the cramping and stuff that's going on, and you'll feel a lot better. I'm going to perform hand hygiene and bring this bed up to a comfortable height for myself. Arena, this is going to be kind of uncomfortable at first, but once it's in, it should not be uncomfortable at all, and it'll make you feel a lot better. But if at any point in the procedure of the insertion, if you can't tolerate it at all, just lift a finger and I will stop, and we'll take it out just so that for your comfort. Arena, do you have any history of any like facial trauma or surgeries that I should be aware of? No? Okay. And do you have any allergies that we should be aware of? No. Cool. All right, so I'm gonna put that towel on you just to protect your bed sheets and your gown and things like that. And I'm gonna put on some gloves. And I'm gonna first check in your nose just to make sure your nares are clear and ready for insertion. And I'll check your gag reflex as well, just to make sure that you're able to swallow. Perfect. All right, now I'll toss this. All right, so Arena, I'm gonna give you a emesis basin here, just in case you need it, and then while we're inserting the tube, I'm gonna have you take sips of water. This will kind of help like get the tube in the right place, but also just make it more comfortable for you as it goes down, okay? And I'll kind of tell you when to start taking those sips as we're inserting the tube. So I've got my 14 French. NG tube here. So I'm gonna first measure this tubing. So I'm gonna measure from her nose to her ear and then down to her xiphoid process. And then per our facility policy, we're gonna add a couple more inches. And I've marked it with some tape here so that I know how far the tube needs to be inserted. I'm going to use some Mani-Lube to help that go in smoothly. Alrighty, Arena, I'm gonna have you tilt your head back for me at first, and we're gonna start inserting, and then I'll have you tuck your chin to your chest and start taking those sips of water as I'm inserting, okay? Alright, you're gonna feel some pressure here. Alright, keep that head back, perfect. Alright, tuck your head to your chin, or your chin to your chest, and start taking those sips of water. And we're almost done. Keep taking those sips. You're doing good. Good job. All right, we are in. Perfect. I'm gonna hold that secure and kind of temporarily, I could use like some skin prep or something on her nose to kind of help this here to her nose. I'm gonna secure this. And then we're going to check the gastric contents just to make sure that we are in the right place here. How are you feeling, Arena? I know that was uncomfortable, but you did it. You're champ. Just got about 40 milliliters of gastric fluid here. I'm going to put this into my cup and get a little pH strip here and dip this in. And I want a pH of less than 5, and it looks like we're at about a 3, so we are in the correct spot. So at this point I would call X-ray, and they would come and do an X-ray to confirm the placement of the tubing is in the right place. So they've come, they've done their X-ray, and so now I'm going to secure this tubing in the correct spot, and then we can hook it up to suction for our patient. And then you will start feeling some relief here real quickly, Arena. Sorry this is going on for you. Okay, so we're going to hook this up to suction, and the physician has ordered our suction to be on intermittent low suction. So I'm going to put that up and turn it on to intermittent and make sure that that's on the low setting. All right, so I'm going to dispose of all of my different things here, kind of clean up the area, remove my gloves, perform hand hygiene, and I'll make sure my patient is in a low and locked position with her call light in reach. Arena, is there anything else I can do for you before I leave? Okay, perfect. So I'm going to go and document in the patient's chart the tube insertion and how well the patient tolerated, as well as any findings I may have found with gastric fluid and things like that.